Kidney disease sneaks up quietly, especially in seniors, where it's often mistaken for normal aging. Your kidneys filter waste, balance fluids, and regulate minerals. But when they falter, toxins pile up, and your skin becomes a billboard for trouble. Studies show over 50% of seniors over 65 have some degree of chronic kidney disease, yet many don't notice until it's advanced. The National Kidney Foundation reports that skin symptoms can appear early, sometimes before blood tests flag issues. For seniors, catching these signs could mean the difference between managing a condition and facing dialysis. Let's explore the 10 skin changes you need to know, why they happen, and what you can do today. 1. Uremic pruritus, the itch that won't quit. Imagine an itch so relentless it keeps you up at night, scratching until your skin bleeds. This is uremic pruritus, a hallmark of kidney disease affecting up to 90% of dialysis patients, per the Journal of the American Academy of Dermatology. Unlike a mosquito bite, this itch often has no rash, driven by uremic toxins like urea building up in your blood. Calcium phosphate deposits and immune system overdrive irritate nerve endings, while opioid receptor imbalances make antihistamines useless. For seniors, this isn't just annoying, it's debilitating. Chronic scratching can cause excoriations, open wounds that invite infections, a serious risk when your immune system is weaker. Nighttime itching disrupts sleep, raising risks for heart disease and depression common in seniors. What to do? Don't ignore persistent itching, especially without a clear cause like allergies. See a doctor for blood tests to check kidney function, AEG, glomerular filtration rate. Meanwhile, moisturize with fragrance-free creams like CeraVe to soothe skin. Avoid hot showers, which dry out skin and worsen itching. Ask your doctor about gabapentin or UVB therapy, which studies show can ease uremic pruritus. Keep a symptom diary. Note when itching worsens to help your doctor pinpoint triggers. 2. Xerosis, when dry skin signals danger. Dry skin is common in seniors, but xerosis in kidney disease is extreme, leaving skin rough, scaly, and sometimes cracking into fish-like scales, acquired ichthyosis. Research in clinical nephrology indicates 50 to 75% of dialysis patients face this, caused by failing kidneys disrupting sweat and oil glands. High phosphorus levels and poor absorption of zinc and B vitamins further damage skin's moisture barrier, creating a cycle of dryness, itching, and infection risk. For seniors, cracked skin isn't just uncomfortable. It's a gateway for bacteria, especially if you have diabetes or reduced immunity. Infections can escalate fast, complicating kidney issues. What to do? Use thick, hypoallergenic moisturizers like Aquaphor twice daily, especially after bathing. Install a humidifier to combat dry indoor air, common in senior homes. Ask your doctor to check phosphorus levels and discuss zinc or vitamin supplements if deficient. Avoid harsh soaps. Opt for gentle cleansers like Dove. If skin cracks bleed, cover with antibiotic ointment and see a doctor to prevent infection. 3. Skin color changes. A visible red flag. Kidney disease can turn your skin pale, yellowish, or darkened, often noticed by loved ones first. Pallor, tied to anemia, affects 20% of stage 3 CKD patients and 90% of those on dialysis per Kidney International. Anemia stems from low erythropoietin, a kidney hormone reducing red blood cells. Yellowish tints come from urochrome and carotene buildup, while hyperpigmentation results from toxins dialysis can't clear, darkening shins, or sun-exposed areas. Seniors may chalk this up to aging or sun damage, but these changes signal systemic issues, Anemia causes fatigue and shortness of breath, reducing quality of life. What to do? If your skin looks unusually pale, yellow, or darkened, request a complete blood count and kidney function tests. Eat iron-rich foods like spinach or lean beef, but consult your doctor before taking supplements, as excess iron can harm kidneys. Protect skin with SPF 30 sunscreen to prevent worsening hyperpigmentation. Monitor energy levels. Persistent fatigue with skin changes needs urgent attention. 4. Nail changes. Your nails tell a story. Your nails can reveal kidney trouble through half-and-half nails, Lindsay's nails, where the upper half is white and the lower half reddish-brown. Studies in the American Journal of Kidney Diseases show this in 20 to 50% of CKD patients. Muirkey's nails, white horizontal bands, signal low albumin levels, common in kidney issues. These changes, linked to hormonal shifts or protein deficiencies, are harmless but diagnostic. Seniors often overlook nail changes, assuming they're cosmetic, but they're a clue to deeper problems, especially if paired with other symptoms. What to do? Photograph. Nail changes to show your doctor, as they can fade over time. Request tests for albumin and kidney function. Maintain nail hygiene to prevent infections common in seniors. Avoid nail polish, which can mask changes. If nails become brittle, use moisturizing hand creams and avoid trauma like heavy gardening. 5. Edema. Swelling. That spells trouble. Swelling or edema makes skin shiny and tight, often starting in the legs, ankles, or face. Pitting edema leaves dense when pressed. Non-pitting feels firm. The Clinical Journal of the American Society of Nephrology notes edema begins in CKD stage 3, worsening as kidneys fail to excrete sodium and water. Facial puffiness, especially around eyes, may indicate nephrotic syndrome, a severe protein-losing condition. For seniors, edema can limit mobility, strain the heart, and cause discomfort, increasing fall risks. Severe cases may signal heart or lung complications. What to do? Elevate swollen legs above heart level for 20 minutes daily. Reduce salt intake. Aim for less than 2,300 milligrams daily per CDC guidelines. Wear compression stockings if approved by your doctor. If swelling spreads or you feel short of breath, seek immediate care. Track weight daily. Sudden gains may indicate fluid buildup. 6. Rashes, more than skin. Deep kidney disease. Rashes appear as itchy, dome-shaped bumps or red dark patches, driven by uremic toxins per dermatology reports. These differ from allergic rashes, often thickening skin and altering sensation. Scratching worsens them, raising infection risks, a major concern for seniors with weaker immune systems. What to do? Resist scratching. Use cold compresses or anti-itch creams like hydrocortisone 1%. See a dermatologist for persistent rashes. They may biopsy to confirm uremic origin. Keep skin clean and dry to prevent infections. If rashes spread or ooze, seek urgent care, as infections can be life-threatening in kidney disease. 7. Acquired perforating dermatosis. Itchy nodules with a cause. This condition causes itchy papules or nodules with central plugs, often on the back or limbs, affecting approximately 10% of dialysis patients, per the British Journal of Dermatology. Scratching triggers collagen expulsion through skin, leaving scars. Linear patterns, Kebnerization, form where trauma occurs. Seniors may mistake these for bug bites, delaying diagnosis. Scarring and infections are serious risks. What to do? Control itching with prescribed creams or antihistamines. Keep lesions clean and covered to prevent infection. Ask your doctor about topical retinoids, which may reduce lesions. Avoid scratching. Trim nails short and wear soft clothing. Regular dermatology checkups are key. 8. Blisters. Painful warning signs. Blisters, like those in Porphyria cutaneotarda, PCT, form on sun-exposed areas, scarring easily. PCT, linked to porphyrin buildup, affects dialysis patients, per the New England Journal of Medicine. Autoimmune blisters, like linear IgA dermatosis, also occur. These can lead to infections, a major risk for seniors. What to do? Avoid sun exposure. Use SPF, 50 sunscreen, and protective clothing. See a specialist for blister diagnosis. Treatments like phlebotomy for PCT or steroids for autoimmune issues may help. Keep blisters clean and avoid popping them. Monitor for fever or pus, signaling infection. 9. Calciphylaxis, a life-threatening emergency. Calciphylaxis, a rare but deadly condition, causes painful purple patches that ulcerate, common in dialysis patients, per the Journal of the American Society of Nephrology. Calcium clogs small blood vessels, leading to tissue death. Unlike benign calcium nodules, calciphylaxis has a high mortality risk from infections. Seniors may mistake early patches for bruises, delaying critical care. Early intervention is vital. What to do? If you notice painful, discolored patches, seek emergency care. Ask about sodium thiosulfate or wound care treatments. Monitor for fever or worsening ulcers, signaling infection. Maintain a low phosphorus diet under medical guidance to prevent further calcium buildup. 10th. Uremic frost, a rare but dire sign. Uremic frost, a powdery white or yellowish coating on skin, signals severe kidney failure with blood urea nitrogen over 200 milligrams per deciliter per historical nephrology reviews. Urea crystallizes through sweat, causing intense itching and an ammonia odor. Rare today due to dialysis, it's a red flag for urgent care. Seniors may confuse this with dandruff or dry skin, but it's a medical emergency. What to do? If you see powdery skin deposits, seek immediate medical attention. Dialysis may be needed. Avoid scratching. Use gentle moisturizers. Request urgent kidney function tests. Stay hydrated, but follow fluid restrictions if prescribed. Why this matters for seniors. Kidney disease progresses faster in seniors, and these skin signs are your body's SOS. Early detection through blood tests, lifestyle changes, or treatments like dialysis can slow progression. Ignoring them risks heart failure, infections, or irreversible kidney damage. You deserve to live actively, not sidelined by preventable complications. Practical tips to protect your kidneys. Diet. Follow a kidney-friendly diet low in sodium, phosphorus, and potassium. Limit processed foods and consult a dietitian. Hydration. Drink water as advised by your doctor. Too much or too little can stress kidneys. Exercise. Stay active with low-impact activities like walking or chair yoga to boost circulation and kidney health. Medications. Review meds with your doctor. Some, like NSAIDs, harm kidneys. Regular checkups. Get annual kidney function tests, especially if you have diabetes or high blood pressure, which 70% of seniors do, per CDC. Share this video with someone you care about. It could save their life.